Reaction and support have been pouring in following former President Joe Biden's prostate cancer diagnosis. And this morning, so is an effort to raise awareness. Let's look at the numbers. According to research from the American Cancer Society, 1 in 8 men will be diagnosed with prostate cancer. Data predicts about 1 in 44 men will die of prostate cancer, making it the second leading cause of cancer death for American men. And joining me now to explain how this impacts all of us and shine a light on how to curb those statistics, we have Orlando Health urologist, Dr. Stephen Brooks. Good morning, Dr. Brooks.
Good morning.
So in the simplest terms, how would you explain prostate cancer when you have a patient coming into your office?
Sure. Well, prostate cancer is a very common cancer in men, as you've just mentioned. It tends to be a disease of older men. 75% of diagnoses are in men over age 65. Early detection is critical in this disease. We have not yet evolved to the point of preventing the disease, but we can certainly find it early. And when found early, it's an extraordinarily treatable disease. So I always emphasize to my patients, this is indeed not a death sentence. Modern medicine has made tremendous strides in the treatment of prostate cancer.
And let's dive into the magnitude of former President Joe Biden's diagnosis. His personal office put out a statement, said he was diagnosed with prostate cancer characterized by a Gleason score of 9, grade group 5, with metastasis to the bone. Can you help us, doctor, understand what the Gleason score is, the severity of all of this diagnosis on that scale?
And it's particularly striking that the most watched man in the world, perhaps, is diagnosed with such a high-grade cancer. A Gleason 9 cancer represents only about 12% of prostate cancers. Now, what is a Gleason 9? Dr. Gleason was a pathologist at the VA system, and he had access to lots of prostates, and he was able to correlate the appearance of the tissue under the microscope with its clinical behavior. And he was able to assign certain characteristics that corresponded with aggressive cancers and certain characteristics that corresponded with less aggressive cancers, thus the Gleason score. So it's a universal language among urologists. I could call a urologist in Russia and say, hey, I have a patient with a Gleason 9. Gleason 9 is a very high-grade cancer. Now, it's a little counterintuitive, but it's not a scale of 1 to 10. It's basically a scale of 6 to 10. A Gleason 6 is a low-grade cancer. A Gleason 9 and Gleason 10 is among the most, is the most aggressive prostate cancer someone can have. Only 12% of newly diagnosed cancers are Gleason 9, and the most concerning aspect of his diagnosis is the fact that it has already metastasized to the bone. So we're no longer looking at a curable disease. By definition, it's metastatic and incurable, but it's a highly controllable and manageable cancer, and it's not a death sentence.
And let's talk about the former president's age, 82. How does that factor into treatment for him?
Correct. At 82, the treatment actually would be no different at his extent of disease than if he was 52. We base treatment on a patient's health in this circumstance and not so much their chronological age. His treatment is going to be very standard. I can predict it'll be utilizing something called androgen deprivation therapy. Prostate cancer requires testosterone to grow. It is the fuel that feeds the engine of prostate cancer. If you can deprive the patient of their testosterone with various medications, you can have a striking response. So his treatment will be identical to a 50 or a 60-year-old with a similar diagnosis. We're no longer looking at a surgical option because, in fact, it has already spread beyond the confines of the prostate. So removing the prostate would not resolve the cancer. So his treatment will be the same whether he's 82, 72, 62. My understanding that his general health is good. I know there's been some controversies with some of his issues, but I would imagine that we'll go full steam ahead with this testosterone therapy, this ADT, androgen deprivation therapy. That would constitute either a shot or a pill, and the response can be absolutely striking.
All right, Orlando Health urologist, Dr. Stephen Brooks. Dr. Brooks, we really appreciate your insight this morning.
My pleasure to be here. Thank you.